Hello, I'm Jim Roberts. I'm host of Senior Living in Alexandria. We're here once again on our monthly program of jam-packed information that should be of interest of seniors, but not just seniors, but family, friends, caregivers, service providers, and so forth. Once again, we've got a very exciting guest today, and we're looking forward to hearing from him. He's Dr. Bassem Khan. He's the Executive Director and Chief Physician of the Northern Virginia Health, which is an extensive organization with roots in the community and of incredible service to the community. We want to focus on seniors today, but I also want to let you know a little bit more about what the organization does. It's quite impressive. So, Dr. Khan, welcome, and very good to have you with us here today.
Great to be here.
Great to do that. Tell us a little bit about your background. How did you get into community health?
Sure. I trained as a physician on the West Coast in Los Angeles and then in San Francisco. And at that point in time, I knew that I had an interest in primary care and working in the community. So I moved to the area in 2011 because my family was in the area.
To the Washington area?
To the Washington area. And I looked for organizations that were based in the community and that served the underserved, so people who have difficulty getting access to healthcare elsewhere. And I came across Neighborhood Health, then known as Alexandria Neighborhood Health Services, and joined it as a physician, an internal medicine physician on their staff. And I've been doing that ever since then, but currently I'm in the role of executive director as well. And it's work that I love.
What, you mentioned community health or a community physician. Is that a somewhat unique proposition, or is that a specialty now that's recognizable, or is it just your personal ethics and choice?
It's not a specialty of its own. People who work in community health centers, and I can go into more detail about community health centers in general, they tend to be primary care doctors like any other. So internal medicine, family medicine, pediatrics, sometimes gynecology, but with an interest of being in an organization that serves everyone. So even if you don't have health insurance, or you come from a different culture, speak a different language, are low income, that an organization that welcomes those patients as well. And that's also based in the community in the sense that it's very connected to different community organizations and really listens to the needs of the community in planning its services. So you don't need to have any specific training for that. There are lots of physicians who are fortunately interested in that kind of work.
How did you personally get interested in it? What was your motivation?
I grew up in Pakistan, developing country. My parents were originally from there. And growing up in that setting, you notice right away the amount or the levels of poverty. And very early on, I knew that I wanted to get involved in some way that helps those that are less fortunate. And I also was interested in becoming a doctor, and that's why I found that you can do both. You can be a physician, but you can also work in settings like mine where you get to serve the underserved. You know, initially my interest was in international health. I wanted to work for an organization like Doctors Without Borders, for example, in some part of the world. And I used to do that kind of work to some degree, but realized that there's enough need right here in the U.S., in our own communities. There are people who don't have access to healthcare, so I felt that it would be good to be able to live here, work in the community, and make a long-term commitment in that sense, and I've enjoyed it a lot.
How'd you get involved with Neighborhood Health?
I just searched the organization on the internet. It was a Google search.
Match.com?
No, not Match.com, Google.com.
Oh, I see, okay.
And, I looked for a community health center serving Alexandria, and they're the only one. And, I joined it back in 2011 and remember my first day at work, and I just loved the patients. I love the other very committed staff who work there, both physicians and nurse practitioners, but all our staff, who are really committed to the community, and I've been there ever since.
Tell me about Neighborhood Health, its origins and the scope and its growth.
It's got a fascinating story. It started 20 years ago now.
20 years, okay.
This is our 20th anniversary year in this apartment complex in Arlandria, which is in the north end of Alexandria, borders Arlington, also called Chirilagua, very large population of immigrants originally from El Salvador. And it was started by nurses from the Alexandria Health Department who wanted to provide services for low-income people in this apartment complex. So it started within the apartment complex, and patients would actually just come down to get services.
From the neighborhood.
From there, or from the same apartment complex.
Okay.
And it started, the first year we served 1,500 patients, fairly limited scope of services. But then we just grew, and a big point in evolution was in 2004, when we became a federally qualified health center, where we received some federal funding. Doesn't cover our complete budget. It's only a quarter, a third of the budget, but with it come a lot of responsibilities in terms of our scopes of services, a lot of guidance, and we've grown since then. So currently our organization serves 15,000 patients every year.
15,000?
15,000.
Wow.
Through 50,000 visits, so doctors' visits. But our scope of services is much broader. We like to call ourselves a medical home for patients. That's where the patients can come and get a wide array of services. They see, your physician, but you can also get lab services. You can get basic preventive screening, so immunizations, cancer screenings, but you also get dental care because oral health is, sometimes it shouldn't be separated. You get mental health care as well. So if a patient screens positive for depression, they can see a behavioral health counselor as well, and we like to integrate that. They get case management. They get assistance with medications because, you probably know that the cost of medications has gone up. So we're able to help people with that and provide them low-cost medications. And what's important to know is that our services are available to everyone. If you don't have health insurance and you're low income, you're able to get services at our health center. We put people on a sliding fee scale, people who live in families of less than 200% of poverty. So that's about $40,000 for a family of three. They go through an eligibility process, and we're able to serve you if you don't have health insurance or if you do have health insurance. And if you have health insurance, if you have Medicaid, we serve you. If you have Medicare, we serve you. If you have private insurance, we serve you. And what we also do is if you have very high co-pays and deductibles, we put you on the sliding fee scale as well. So the idea is ultimately to promote access to care, because we know that in our community there are lots of neighborhoods where, even in Northern Virginia, where people, because of being low income, are not having health insurance, or not having health insurance that anyone else takes. You're not able to see a doctor.
What proportion would you say do not have health insurance from your experience?
In our clinic, half of our patients don't have health insurance.
Okay.
So out of 15,000, about 7,500 don't have any health insurance. And for many of these patients, there are no other options or few other options. And we're able to provide them with primary care. And one thing we like to say, it's the same quality of primary care that you get anywhere else. We have well-trained doctors. We provide the same type of primary care. We've gotten national awards for quality metrics that we track, because it's really important for everyone to have access to primary care. Because if you don't, then it leads to problems down the road. People, different conditions go missed, and people end up in hospitals and emergency rooms. So we incur the costs anyway as a society, but the idea is to prevent it, to not let things get out of hand.
It sounds like you're doing basic family medicine, which obviously is birth, common diseases, injuries. Are there things but then you would rely on specialists for cardiac or ear, nose, and throat or whatever. Do you have relationships with either private doctors or hospital practices?
We do, although I'll admit that it's difficult for people without health insurance.
Right.
So if a patient has health insurance, we'd refer them, like any other practice would, to a local specialist. But if you don't have health insurance, the options are fairly limited, and we have to rely on relationships, or even sometimes people go down to UVA in Charlottesville. And that's something we struggle with. Over the years as a physician, I've had a tough time getting people to get specialty care that they need. I'd like to say, though, that it's really important for people to have a medical home, because at least when they're part of the system, we're able to try to take care of them even if it's difficult. But what worries me most is when people are not even part of the system. Sometimes what we do is we try to manage a little bit more on our own, or we try to call someone and try to say, listen, can you squeeze this patient in? Or we try to navigate the process and help them apply to certain programs to go to UVA, for example. So it's difficult, but at least we're able to make it work. My concern is when people who don't know about us, or sometimes we're not able to serve everyone, although we've expanded a fair amount. Those are the patients or the people who concern me the most, because our goal is that everyone in our community, in Alexandria, in Arlington, and in Fairfax County, has access to primary care. And we define primary care broadly. So primary medical care, but also the dental care and also mental health care.
Oh, okay.
Yeah, because we're able to provide all those services.
How many offices do you have? It sounds like they're conveniently located.
We've grown from one little location in this apartment complex to 10 locations across Arlington, Alexandria, and Fairfax
that's terrific.
County.
Good.
And many, some are larger sites, some are smaller sites, some offer more limited services, some offer larger, more services. Our site in Arlandria on Glebe Road is fairly comprehensive. There's one at the Casey Clinic on Alexandria Hospital, which is fairly comprehensive, and then there's one on Route 1 in Fairfax County, which is also fairly comprehensive.
Good. Well, then so it sounds broad and comprehensive and targeted to the community that doesn't have it. It seems to me that in recent history, if you had a medical need in many communities, you'd have to go to the emergency room. At least in Alexandria and Northern Virginia, is it now the case that you would go to community health, neighborhood health as an alternative, or
that's our hope, and our mission is to try to grow so that we can serve more patients. Because our hope is that people don't have to go to the emergency room, that they can come to organizations like ours, and if they're uninsured, they can apply for our sliding fee scale and we get them on. Or if there are people with Medicaid, Medicare, private insurance who might have challenges because of high copays and deductibles or drug costs, that we're able to get them into the system as well.
Great.
And what that does is it prevents them from going to the emergency room, because then we're their medical home. We have clinics that are open evenings, some of them are open on Saturdays. We have an after hours line, so if you're sick after hours, you're able to call and speak to a nurse, or there's a doctor on call. But that's our goal, to try to keep people out of emergency rooms, out of the hospitals, and to make sure that their needs are taken care of.
We need to go to a break, but when we come back, we very much want to focus on what you do related to seniors.
Fantastic.
So thank you very much and for that background. That's a robust organization doing really good work.
Thank you.
Thank you. And thank you for recognizing that need and being willing to serve. But we'll be back in just a short while and talk about seniors.
Great.
I'm a retired school psychologist, and helping people was my thing.
I was very independent and thought I could take care of myself. I fell and I had to have Meals on Wheels.
After my stroke, When Meals on Wheels started, I was on the other end of the stick, so to speak.
Meals on Wheels, coming to my door as someone who's housebound, having someone check on me, assures me that I'm not forgotten.
Meals on Wheels has given me a mode of freedom that I wouldn't have otherwise.
We're the clients.
We are the clients.
We are the clients of Meals on Wheels.
America, let's do lunch.
1 in 6 seniors faces the threat of hunger, and millions more live in isolation. Drop off a hot meal and say a quick hello. Volunteer by donating your lunch break at americaletsdolunch.org.
We're back with Senior Living in Alexandria, and today we're talking about senior health, but we're focused on neighborhood health. My guest today is Dr. Bassem Khan. He's Executive Director and Chief Physician of Neighborhood Health in Northern Virginia, particularly located in Alexandria. In the last segment, we talked a little bit about the organization, gave a robust profile of that and how he came to it, but now we want to talk a little bit about seniors, of all things. So, Dr. Khan, what are some of the issues that your clinics encounter, particularly issues that would be specific or identifiable with seniors?
You know, like any clinic, we try to manage and help seniors with many of the challenges that they face. And two that I want to mention, because they're more relevant to us, is first of all, as you know, seniors, by and large, many of them are living on a fixed income, and the cost of living is going up in Northern Virginia and other parts of the country. Drug costs are expensive. So what neighborhood health does, because it's our mission, is it provides a way for seniors to access health care at an affordable cost. So clearly seniors who don't have health insurance, but even seniors who have Medicare, sometimes costs can be a problem. One way that we do that is drug costs. We have special programs where people can get their medicines for free or for low cost.
Okay.
And as you know, seniors with multiple chronic diseases and multiple medicines, those costs can get out of hand. And we have pharmacy technician staff who not only help them get low cost or free medicine if they're low income, but also help manage some of that as well, to try to check that you're taking the right medicines, that you're not mixing them up. So that's something that's important. And our focus is trying to provide access to affordable healthcare. So many seniors, even seniors on Medicare, who have challenges with costs, we're able to help them. The other piece of that is other services other than medical care. For example, dental services.
Okay.
Medicare doesn't cover dental services in many cases unless you get supplemental plans. Well, what we're able to do is offer them, even people who don't have dental coverage, low-cost dental care. So that's something that's important for seniors. We're able to refer them to social services because we work with patients who are low income and have a lot of these needs. The other thing that we do specialize in a lot is mental health. We provide on-site counseling. So later in life, issues of depression become even more prevalent. We screen everyone for depression. And what's good about our model of care and this comprehensive model of care is that if someone screens positive for depression and they want to see a counselor, we're able to have them see the counselor right then and there on the same day.
Integrated within the other services.
We just
Okay.
walk them to the other room, introduce them to the counselor, and it's integrated. So the counselor and the primary care physician work in the same space and can talk.
Okay.
And as you know, medical health and mental health are very interrelated. If you manage one, you can help manage the other and vice versa. The other piece is a lot of seniors have more serious mental health concerns. Schizophrenia, bipolar disorder,
Okay.
severe depression, and many of them get services at our local community services board in Arlington and Alexandria, and in Fairfax County at the Gartland Center, in Alexandria in Old Town, and Arlington up in Sequoia. So what we do is we send a primary care doctor to each of these locations 3 days a week, and we provide integrated care where you can get access to the mental health services that they provide, but then primary care as well. And we see you, again, regardless of your financial status. So if you have Medicaid, Medicare, no health insurance, you have high drug costs, we try to work with you and bring all of that down. The other piece I'd like to say is more than ever for seniors, you want to provide comprehensive, like a primary care medical home style of care where you're taking care of all their concerns comprehensively and doing case management and having people come in regularly to see the doctor to address all these needs. So that's our model of care as a community health center. I think our experience working with the most vulnerable in our community, people who don't have health insurance, people who are low income, I think allows us to provide better access to care to seniors as well, because many of them deal with the same issues.
That takes a degree of integration of different skills or different areas of knowledge. Is that automatic or part of, it sounds like it's part of your philosophy in practice? Does that work out?
It is, because in the same site you're going to have internal medicine doctors or family medicine doctors, you're going to have nurse case managers, you're going to have behavioral health counselors who talk, there's back and forth communication. You're going to have pharmacy technicians who try to see, are you having problems paying for medicines? Because sometimes it's ridiculous what you see. I've had patients who've come to me and said they pay hundreds of dollars for medicines, and it really gets to me because sometimes you can get them onto different programs where those costs can come down, right?
No, they just don't know.
They just don't know.
Right.
And they can use that money to pay for other needs, and oftentimes it's actually food and housing. So you have all those staff in the same space. We have family services workers, sort of like social workers who help with needs as well. So the idea is you want to provide an integrated medical home where you can take care of all these needs. And one thing I'll tell you is our concern across the country are the costs of healthcare, and rightfully so. Yeah. In America, healthcare costs per capita almost twice as much as any other country, and that takes away from all these other priorities. One way you bring costs down is you provide good, integrated, high-quality, affordable, accessible primary care so that you prevent other issues down the road. When seniors or anyone else are not able to get into their practice to see a primary care doctor, what happens? They go to the emergency room.
Right.
They go to specialists more sometimes, which can become more expensive, or basic medical needs are not taken care of, and then down the road it leads to more problems and hospitalizations.
Well, and communication among the specialists or even primary care physicians would be perhaps imperfect.
Oh, and that's a whole nother issue, right? I mean, because it's,
and your model, I think,
it helps with that. It helps with that. And, we're not the only ones. I mean, I think the whole industry is moving in that direction in general. But, for us, we're grounded in the community. Our focus is access to care. That's why we were formed. The whole purpose of our existence is try to get access to care
for people
who don't have it.
Speaking of access, how do people find you? How do they know about you? How do they... do they look it up in the phone book? Is it online? Do you do training and educational programs? Do you do community outreach? Do you do all of the above? Word of mouth, be known to families?
All of the above.
All of the above.
So we do outreach in the community, including in senior centers. I recently was at one where we talked about dental services. They can call our main phone number. They can look up neighborhood health on the internet and get in touch with us. Come into any of our sites. We're trying to get the word out more and more in the community about our services.
Do you do home visits?
We don't do home visits at this point in time. It's something we've thought about, but at this point in time we don't do it, although we work with agencies that do home visits and then try to integrate as much as possible with them.
You'd also have to deal with organizations that provide transportation then if they decide it's time to go to the clinic or I need to get things checked out or whatever.
We do, and
which are available to seniors.
Exactly, and we're used to working with them. I think again because of the fact that we're grounded in serving, the underserved in our community. So more of our patients would need those services than perhaps other locations.
Do you? Well, one thing I do want to note, and that you have a senior health and fitness fair and I want to be sure and get some. What is that about? And it's scheduled for May 24th at the Lee Center.
Yeah.
What's
and
that about?
We work with Senior Services of Alexandria, a wonderful
Okay.
partner, obviously, organizing this, and they're hosting this fair for seniors where there are breakout sessions and different topics, and we're going to be participating in it as well, talking about senior health, talking about our services, just for the reason you stated, trying to get the word out in the community. And I think that's the final point that's a point that I want to make, which is we've gotten to where we are as an organization, not just because of our efforts, but because of so many people in the community who share in the goal of providing access to healthcare to everyone who needs it. So we work with health departments, we work with community services boards, schools, hospitals, nonprofits, because it takes a whole lot of people to get there, both in terms of fundraising, but also in terms of partnerships and referrals and joint programming. So it really is a community effort to get our community to the point where everyone has access to the care they need.
That's great. We're out of time, but there will be information on the fitness and health fair. People like me could go there and maybe A, learn, but B, probably take some measures of my health, which would always be a good thing. Really thank you for this information. I think that the community needs to recognize what you contribute to the community, and your personal passion for it, I think, are very important and very praiseworthy. So thank you very much for your information and for your commitment.
Thanks.